Today, we'll be looking at personality disorders. My name is Dr. Peter Boakye-Boama, medical doctor and a resident in the psychiatry department, Kumasi, Ghana. My email is peterboakye27@gmail.com. What is personality? Personality is the set of enduring behavioral and mental traits that distinguish individual humans. It is thus the dynamic organization within an individual that determines his or her adjustment to his or her environment. Dimensions of personality or personality traits. We use the acronym OCEAN, OCEAN. 1. Openness to experience. This talks about the desire to have new experiences. 2. Conscientiousness. This is how organized or disciplined a person is. 3. Extraversion. This is how sociable or talkative a person is. 4. Agreeableness. This is how compassionate and cooperative a person is. 5. Neuroticism. This is how easily a person experiences unpleasant emotions or the degree of emotional instability. Personality disorders, the outline. 1. Definition. 2. Etiology, risk factors, and epidemiology. 3. Types under DSM-5 classification. Then 4. Management. Definition. A personality disorder is a mental health condition where people have a lifelong pattern of seeing themselves and reacting to others in ways that cause problems. People with personality disorders often have a hard time understanding emotions and tolerating distress. Personality disorders are characterized by experiences and behaviors that deviate from social norms and expectations. This makes it hard for them to relate to others, causing serious issues and affecting their family life, social activities, work and school performance, and overall quality of life. Etiology. The exact causes are not fully understood. It is, however, thought to arise from a complex interplay of genetic predisposition and environmental factors, particularly early life experiences. While a combination of inherited traits and life events like childhood trauma and neglect is also believed to contribute to their development. Etiology again. The causality can be categorized as follows. 1. Necessary causes. 2. Sufficient causes. 3. Contributory causes. And socio-economic factors like childhood trauma. Risk factors for personality disorders. These are factors that predispose or increase a person's chances of having a personality disorder. 1. Specific personality traits. This includes always trying to stay away from harm or the opposite. 2. Early life experiences. This includes a home environment that is not stable, predictable, or supportive. It also includes a history of trauma, neglect, or sexual abuse. 3. Complications like perinatal injury. Examples are trauma and infection. Epidemiology. It affects around 6 to 10% of the general population. DSM-5 classification of personality disorders. Under DSM-5, personality disorders are grouped into 3 clusters. We have cluster A, which has paranoid, schizoid, and schizotypal personality disorders. Cluster B, which has histrionic, narcissistic, antisocial, and borderline personality disorders. Then cluster C, which has avoidant, dependent, and obsessive compulsive personality disorders. Now let's look at them in detail. Under Cluster A personality disorders. 1. Paranoid personality disorder. Here, there's excessive suspiciousness. The person is excessively sensitive, and the person has excessive importance of themselves. 2. Schizoid personality disorder. Here, the person is detached, prefers solitary activities, and they are emotionally cold. 3. Schizotypal personality disorder. Here, the person has odd beliefs and magical thinking. Now, Cluster B personality disorder. 1. Histrionic personality disorder. Here, the person is excitable, overtly emotional, dramatic, extroverted, attention-seeking, and sexually seductive. 2. Narcissistic personality disorder. Here, there's heightened sense of self-importance. 3. Antisocial personality disorder. Here, there's regard for and violation of rights of others, unlawful behaviors such as theft, lying, truancy, conning, and substance use disorders. 4. Borderline personality disorder. Here, there are significant mood swings, unstable relationships, self-destructive acts like slashing the wrist or overdose of medications, impulsive in spending, sex and substance use, identity disturbance, and unstable self-images like sudden changes in life goals, and exhibits a defense mechanism called splitting, where they consider each person as all good or all bad. Now, Cluster C personality disorders. We have avoidant personality disorder, where they are sensitive to rejection. Dependent personality disorder, where they are dependent on others for everyday decisions. Then obsessive compulsive disorder, where they are preoccupied with rules and regulations, and they give excessive importance to details and perfectionism, which interferes with task completion. Now, management of personality disorders. The management involves a combination of psychotherapeutic, behavioral, and occasionally pharmacological interventions. Psychotherapeutic and behavioral interventions include psychotherapy, where individual therapy has been the mainstay of treatment. Cognitive behavioral therapy can also be done. Then dialectical behavioral therapy. This is specifically for borderline personality disorder, and it's a type of therapy that helps individuals manage intense emotions and develop healthy coping mechanisms. Other therapies include psychodynamic therapy, mentalization-based therapy, and psychosocial therapies like family therapy and group therapy. Now, pharmacological management using psychiatric medications. They are not primarily used for treating personality disorders, but they are, however, prescribed to address co-occurring symptoms such as anxiety, depression, and impulsivity. Common medications include antidepressants for mood-related symptoms, anxiolytics for anxiety, and antipsychotics for cognitive distortions and paranoid ideations. We come to the end of our discussion, and our quote is "Protect your mind as usual, for it is your home." Thank you very much.